Well, thanks, Romy. So before we get into the specific studies that Rose actually critiques, it's just really helpful to go over the limited capacity for nociception in fishes. So as Romy just covered, you have these A delta fibers and these C fiber nociceptors. So the A delta fiber is producing this rapid avoidance response, with the C fiber is producing this slow, painful response that has the requirement for healing and recovery. And it's the healing and recovery that would actually increases a fish's vulnerability to predation. It would decrease its capacity to function in its environment, and ultimately it would decrease its fitness. So this behavior would naturally be selected against, which is why we don't really see a high capacity for nociception in fishes. It's also really evident when you compare how fish respond to injury compared to humans or mammals in general. So when a fish experiences an injury, it's typically in the short term, it diminishes within minutes or hours, whereas in humans, an injury results in this crippling nociception pain that can persist even for days after the injury. So the three studies that Rose actually critiques here are the ones involving acid or venom injections, the ones involving surgery, wounding, or electronic tagging, and then neurological examinations. So we'll start with the acid or venom injections. So there's many studies that Rose critiques here that use these methodologies. The main one that he focuses on is Sneddon et al. 2003a. The issues in Sneddon's study are very much representative of the other issues in the other studies, so it's also why we're going to focus on it in our presentation. So one of the main issues is that Sneddon and co-authors use invalid and outdated criteria for identifying pain. So they try to show that an animal should have the same noxious stimulus that a human has. But this is problematic because it requires the presence of nociceptors, but nociceptors alone are not sufficient or necessary for the experience of pain. For example, in humans, a human undergoing surgery in the wrist, there'd be intense nociceptor activation in the wrist, but due to the use of anesthesia, the human themselves wouldn't actually be experiencing pain. On the flip side, you can have humans that are experiencing pain without any nociceptor activation. An example of this would be someone experiencing chronic pain. Additionally, they try to identify pain by showing that a noxious stimulus should produce adverse psychological or behavioral effects. This is invalid because these effects, they could be produced basically without a conscious. Humans regularly execute these behaviors unconsciously. They also try to show that animals should learn to avoid a noxious stimulus. This is invalid because avoidance learning uses unconscious associative learning, and as Romy mentioned earlier, consciousness is an essential component of experiencing pain. So avoidance learning is unconscious associative learning. And then finally, they try to show that these behavioral impairments should be more than a simple reflex. And again, they really fail to define what a simple reflex is compared to a complex one. And again, humans regularly do complex, goal-oriented behavior unconsciously. An example of this would be someone who's sleepwalking. So moving on, Sneddon and co-authors' results contradict their own claims that the trout were experiencing pain. So when a trout is stressed, it releases something called corticotrophin releasing factor, or CRF. And when CRF is released in the fish, it's a locomotor activator. So you would expect to see their swimming behavior affected, but this didn't happen. Their swimming behavior was unaffected. Additionally, when CRF is released in the fish, it suppresses their feeding, but again, their feeding behavior was unaffected. So it's really unlikely that the trout were actually stressed from these acid injections. And they also, as Romy mentioned, they observed this rocking behavior and the trout rubbing their lips on the bottom of the tank, and they tried to say this was evidence of pain. But it's actually much more likely that the rocking behavior was the result of the anesthetic that was used, impairing their balance. There was another study, Newby and Stevens 2008, they replicated Sneddon's study exactly, they just didn't use anesthetic, and they didn't observe this rocking behavior at all. In addition, the rubbing behavior that they saw, this was really inconsistent. So fish that had the acid injected in their cheeks, they did occasionally rub their lips on the tank, but the bee venom didn't elicit this response. And again, there's no justification that the mouth rubbing was conscious behavior. For example, there are several studies that have actually entirely removed an animal's cerebrum, and they still show this purposeful behavior. And finally, Seddon and co-authors failed to consider the problem of acid leakage at the oral injection site. So the acid leaking from the oral injection site results in a more general reaction. So it's questionable if they are actually identifying specific nociceptor activation or more general effects from the acid. For example, when fish are in acidic water, it causes them to jump out of the water, it increases their opercular movement, and it generally results in really abnormal behavior. So the unusual behavior that they saw in these trout, their increased opercular movement, could very well just be a result of irritation from the acid rather than actual nociceptor activation. And finally, Seddon, they used morphine in their study, and there's lots of evidence that show that opiates have a very diverse range of effects on the nervous system. So again, it's really questionable if they were actually specifically activating nociceptors or if the morphine was having more general effects on the nervous system. And also, it's very likely that the trout deal with opiates much differently than humans. This is because in their study, they literally used 10 times the lethal dose of any studied bird or mammal, and the trout's behavior was unaffected. So that's really significant because if I were to administer 10 times the lethal dose to any one of you, your behavior would probably be affected. So moving on to studies involving surgery, wounding, or electronic tagging. So again, several studies that Rose critiques here. Really none of them resulted in anything. Wagner and Stevens, 2000, they looked at the swimming behavior in rainbow trout after having not pit tags, sorry, they just had surgery done on them. And really their swimming behavior was unaffected at all. Newby et al., 2007a, they looked at feeding behavior of rainbow trout after having pit tags inserted in them. Their feeding behavior was unaffected. After 30 minutes recovery, they resumed feeding within 5 minutes. The amount of food they ate wasn't affected. Their time to fatigue wasn't affected. And then also Cook et al. 2002, they looked at smallmouth bass and the effect on their parental care after having radio transmitters implanted in them. And same thing, the bass resumed parental care within minutes. And then there were several studies that looked at the social migratory behavior of several fish after having pit tag inserted in them, and again, they resulted in no change. So really, the main takeaway here is that if fish were experiencing pain the way a human would if they underwent these same procedures, then the type of functioning that was observed in these fish would be surprising rather than the norm. Okay, and finally, we're going to talk about studies involving neurological examinations. So same thing, a lot of studies critiqued here. We're just going to focus on the main takeaways. So Rose sort of defines these A delta fibers as producing this first or bright pain. And this pain, it activates regions in the brain responsible for processing spatial location, temporal parameters, and the stimulus intensity. Now the C fiber nociceptors, he defines this as the second or burning pain. Now it activates similar regions in the brain as first pain, but an important distinction is that it activates the regions also responsible for suffering, which as Romy talked about earlier, suffering is a really essential distinguishing component between actually experiencing pain versus just nociceptor activation. It's really more interesting when you actually look at the C fiber count in fish compared to humans. So one study looked in the tail nerves in carp, and they determined that about 38.7% of the sensory axon population was A delta and C fibers. Now, only 5% of that 38.7 were C fibers, and an even smaller proportion of that are C fiber nociceptors. So again, even though there are C fibers, not all of those are actual nociceptors. So again, there's a really, really small proportion of these sensory axons that are nociceptors. This is in stark contrast to humans, where if you look in the sural nerve, which is in the calf region of the leg, a normal human has about 83% C fibers. Now, humans can suffer from a condition called congenital insensitivity to pain, which basically results in a complete loss of the sensation of pain. Now, those humans have 24 to 28% C fiber count. So this is really, really significant because if in a human, 24 to 28 C fibers results in the complete loss of pain, then the sub 5% nociceptors in fish is really insignificant. And this is basically one of Rose's main arguments, is that the really small number of C fibers is really not a functional domain for fish at all, and the A delta fibers that elicit this quick avoidance response is much more functional and beneficial for them in their natural habitats. And finally, just to wrap up my final point, when you compare teleost to elasmo branches, so elasmo branches are like sharks, rays, skates, and sawfish. Those types of fish are even more ill-equipped to experience pain than teleost. So they actually have literally no C5 receptors at all. So it's really no surprise that teleost also would be ill-equipped to process pain.
All right, so in